We have also placed a lot of emphasis on care and treatment, and this happens at all of our regional hospitals and, of course, at the Georgetown Public Hospital Cooperation. Some of the novel things that we have been doing with our treatment for the more critical patients, we have introduced the use of convalescent plasma, and many of you who are following those stories would know that by now we have treated 7 patients who were critically ill. We'll continue to use convalescent plasma because the doctors, having evaluated the patients that they have treated, felt that this is a good method of treatment, and they have seen patients who have been critically ill who got convalescent plasma who would have recovered. So this is something that we'll continue to do. We want to urge the public and the persons who would have had COVID and who would have recovered from COVID, the COVID infection, that if they can help us by coming into the blood bank and donating some of their plasma, because this can help patients that are critically ill and make a difference between life and death. Another medication that is used for the treatment of COVID has been remdesivir. But remdesivir has been out of our reach for quite some time now, and in fact the company that has been making it has been giving very limited amounts to countries around the world. Most of the remdesivir that has been produced by Gilead is consumed in the United States. We, however, have been able to get a generic version from India, and we have received the first batch of 240 doses, and this would be used in the infectious ICU as of this week. We have already, the doctors here have already decided on the protocol of use, so hopefully some of the very critically ill patients would be able to benefit from this new medication. As we know, with the use of remdesivir in the United States, one of the things that we have seen, it has been able to shorten the severity of the disease, and people who have benefited from this treatment, many of them have been able to recover. Hopefully we can get the same results here in Guyana.